Good afternoon, everybody. I hope you guys are still awake. And I want to thank you, CXO, and thank you, everybody all over the world who are watching me at this time. Some of you maybe good afternoon, and some of you maybe good morning. Now, 3 years ago, we started a company called StabGen LLC with a mission to prevent type 2 diabetes and with a vision to see a world without diabetes. How we're going to do and how it is going to affect the whole approach of preventive care, I'm just going to explain a little bit. Now, we developed a biomarker. We identified a biomarker. We developed a test, and we also developed a therapeutic. Now, all those theories are developed by us to prevent type 2 diabetes. Now, the biomarker is intestinal alkaline phosphatase. It is a very simple but very important enzyme in your gut. Now, we also developed a test that will measure your IP level in the stool, and we can predict the risk of developing type 2 diabetes 5 years in advance based on how much IP you have in that stool. Now, we also developed a therapeutic if you need it. Now, our system was developed with a very simple thing. There are very few things in your gut, and bacteria are one of them. There are gram-positive bacteria and there are gram-negative bacteria. Now, all of them have similar characteristics. Cell walls. The cell walls have called LTA, LPS. Those two things are the toxins if it stays inside your gut. Now, how many of you today brushed? I just want to ask a question. So, yes. So, every day we brush our teeth, and we dislodge our plaque. So, we take care of our gum. We take care of our teeth. Now, who takes care of our gut? We cannot go every day to detox, do things. That's why the nature comes. And that is called intestinal alkaline phosphatase. So, intestinal alkaline phosphatase detox LTA and LPS inside the gut so that there is no formation of plaque in the gut. So what happens when you don't have the intestinal alkaline phosphatase? Those LTA, LPS increases. Eventually, they form a plaque and they start to go to your bloodstream. And there the problem starts. Anywhere they go, this starts the problem. Now, we're talking about type 2 diabetes. So, it goes to pancreas, it inflamed the beta cells, and then beta cells stops producing the insulin. or it can go to the bloodstream, to the cellular level, and they stop resistance. The insulin starts to have resistance. So those two are our main interest. However, if they go any other places, they will have the similar problem. Now, there is another component I put called tau protein. So all those three, I do believe, are the main cause of most chronic diseases we have. All of them have one single point, which is common. It's called phosphodiesterase bond. A bond. IAP cleaves that bond and makes them, neutralize them. And that is our technology. Before my brother, nobody even thought of it. Now, even after my brother, he did the study in type 2 diabetes. So I recently also did an experiment. So what happens if there is low level of intestinal alkaline phosphatase? So I did a study and I found that they form a biofilm and the plaque if there is no IAP. And there is, if you provide certain level of IAP, the plaque does not form or plaque does not attach to the wall. So that is a great finding because most of the diseases are also plaque-associated diseases. And those are CRC, colorectal cancer, atherosclerosis, dementia. All of them have plaque. That is the common. Now, our journey started long ago with now I know this is not a scientific background, but I just want to make our story so that it sticks. We started with mouse study, and we found that the mice without that gene developed endotoxemia and suffer from systemic inflammation. That was a huge finding for the first time. Then that led us to believe that if the inflammation happens without the IAP, then it will have an effect to human too. So Dr. M.S. Malo, my brother, he did the human study. So where he found that all the diabetic patients have low level of IAP compared to the patients without IAP. That confirm and associate IAP to type 2 diabetes. Now, in the study, he followed for 5 years. He also found a very significant finding that remission of IAPD, that means intestinal alkaline phosphate deficiency, prevents type 2 diabetes. What does that mean? That at the beginning of the study, some patients have very low level of IAP. But at the end, somehow they improved and have a higher level of IAP. They did not develop type 2 diabetes, which is huge significant because now we know if somehow we can maintain or increase IAP level, we will be able to prevent it. Now, I want to talk about little bit of obesity and diabetes because most people think that obesity causes type 2 diabetes. But in our study, we found that even the obese people who have higher number of IAP or high level of IAP, they did not develop type 2 diabetes as the normal population. So we did that study and we found, yes, obesity may be related, but it is not the cause. The reason being, I am putting this in front because a lot of commercialization is going on now to add GLP-1 to treat type 2 diabetes. Since I am in the forefront of T2D, type 2 diabetes, I know what can happen. One of the main side effect is constipation of GLP-1. And what happens if you have a constipation? You have low level of IAP and you have constipation. So those toxins stays more time in your body, in your gut. It goes more. So what happens? Severity will increase. Lot of study has been done, but they did not know at that time that what IAP plays the role in inflammation. But they did the study. Now, 3 of them study that there is a bacteria called Fusobacterium. They colonize inside the body, inside the gut, and they create colon cancer. So just because I know the relevance of IAP, that's why I am putting it out so that people can make their decision. If you are obese and you have a problem of also type 2 diabetes, you should be much more cautious taking GLP-1. There are a lot of other supporting articles. They have done extensive studies about inflammation, and there are few of them. And I do believe, and there are a lot of others, but I do believe those 4 have very significant in our history for inflammation. Now, those 5-year studies, we also found that patient who has high level of IAP and patients who has low level of IAP. Patients with the low level of IAP have about 14-fold risk. 14-fold risk, not 14%, 14-fold risk of developing type 2 diabetes. Who is significant? As a scientist, if you get 1, risk ratio even 1, we get excited, and it is 14-fold. So, analyzing the previous parallel studies and our studies, we concluded that IAPD causes type 2 diabetes. So that is a huge significant because before us, no one else have identified that cause. And that's a paradigm shift. I am calling that as a paradigm shift. Anybody knows when the insulin was discovered? It was 1921. In 1921, Frederick Banting and I believe Charles Best, those 2 scientists from University of Toronto. They discovered insulin, and since then, 100 years, imagine now, 100 years we have been using insulin as our main treatment. And which is perfectly right, because that was the only option at that time. And right now, I think we have a better option, and that is IAP, intestinal alkaline phosphatase. We all know what the current technology is, so I'm not going to go details on it, but what is our technology? Our technology based on intestinal alkaline phosphatase, based on stool. Everybody go to bathroom every day. We have children. It is non-invasive. So it is very easy to tackle. Very easy to tackle. Now, how do we implement it? I think that is the issue. Here I'm gonna propose my proposal. Now, every prevention has to have 2 steps, at least two steps. One is to detect, another is to intercept. Without detection, you cannot intercept. Without detection, you cannot intercept. Step test detects, quantify, and measures the intestinal alkaline phosphatase in your stool. So every year when you go to a PCP, you will ask for step test, and you will have a reference point. However, I do believe that every child who is born today must have a record of IAP since they're born. Because the information what I have now, it's not only give a sense of security for that child, we will be able to identify whether that child is at risk or not after birth, just from simple test, step test. Now, going forward, that's every year when you go, you will develop a profile, IAP profile. Now, at the beginning of your in your childhood, you will have high level of IAP if you are normal. As you grow, it drops down, but to a normal level. Now, if that level in a year, and you get all of a sudden your IAP drops down, and that's the time for intervention. So we're providing also when you can intervene. And how do you intervene depends on how much intestinal alkaline phosphatase you have in the gut. If you have a low level, you will not develop, if you have a low level of IAP, you will develop type 2 diabetes. And if you have a high level of IAP, you will not develop type 2 diabetes. That is that simple. Now, we know prevention is better than cure. This is our way to contribute to the society, how to live healthy, how to live happy. This is our way to contribute to the lifespan. This is our way to contribute the aging population to live with dignity. We know we might be late, but still we can protect our next generation with your help. Thank you very much.